Ian Loftus, I'm a vascular surgeon in St George's in London. The Vascular Society was always very important to Professor Greenhalgh. He was president of the society and supported it for many years. And his legacy lives on, really. Today I gave the update on aortic surgery, and it was my pleasure to remember Professor Greenhalgh's contribution to aortic surgery. He really defined the pathways for patient treatment, who we should treat, when we should treat, and how we should treat. And the trials that are now coming from that legacy reflect on his experience and are coming from his centre. So I thought it was very important to remember that today and to reflect on all of the great work he did and how that's continuing through his centre at Imperial. In aortic surgery, we've become very focused at times on one treatment being better than the other. But actually, Professor Greenhalgh always felt that things should be much more centred on the individual patient. And I think we all realise that now. And I personally feel we have to redefine our pathways. So rather than think a patient perhaps needs one treatment or another, actually thinking much more about the complexity of that individual patient and what's best, not just short term, but long term for that individual patient. Some of the trials that are now taking place and some of the way we're looking at guidelines, for example, is going to, I think, really help to define what's better for that individual patient. I'm very aware within the society across Europe there are very different levels of experience and exposure to endovascular therapies. And I think it's really important that we start to try and understand why that is and try and open the doors for all trainees across Europe to the potentials that endovascular therapies have, not just for the aorta, but for lower limb, for venous and other areas. So that's my ambition, is to understand what the blocks are and try and break those blocks down and give opportunities to people in places where they're not available.